I'm Dr. Prathap Kumar. I'm one of the shoulder and upper limb surgeons working at Sunrise Group of Hospital in Kochi. I joined medical school in 1980 after completing my BSc from University College in Trivandrum. I joined at Government TD Medical College, Alapi, and we had 100 students in our batch. At that time, there were only limited seats available in the medical schools, and there were only 4 medical colleges. I passed the MBBS in 1986, and I started my internship, otherwise called house agency, in the same hospital. And following that, I joined as a senior house surgeon in Department of Orthopedics. The encouraging force behind me was my mother. She brought me up right from my infancy because I lost my father when I was a 10-month-old. So she was constantly behind me for each and every achievement I had. Of course, later in my life, I was supported by my family, my wife. My mentor was my brother, who is currently the professor of gastroenterology at Trivandrum Medical College, Dr. Kumar. I also guided by my elder brother, who is a professor of surgery, Dr. Anantapalmanathan. I got another brother who is a professor of physics. When I finished my MBBS, I decided to go with the trauma and orthopedics because I knew by that time it is a very challenging specialty and it is a very developing specialty as well. Orthopedics at that time was trauma and orthopedics as a single unit, and there wasn't any super specialty developed in orthopedics at that time, even though there were specialties and subspecialties developed in orthopedics in the rest of the world. It was my passion to go for higher education to the Western world. Right from I was in medical school. So I was telling my teachers and my friends, one day I will be going to England to take a FRCS degree. Initially when I joined orthopedics as a senior house surgeon, I was inspired by my professor V.K. Bhaskaran, who was the then professor of Government Medical College, Alapi. I completed 1 year there, and then I joined for diploma in orthopedics at JN Medical College Hospital at Aligarh. There I completed my D.Orth in orthopedics and started as a junior orthopedic surgeon at SN Hospital, Sivagiri, Varkala. By the time, my passion to go for higher studies in England, I developed that into a full-blown career time and went to England in 1995. I had to take a qualifying exam called a PLAB, and after passing the PLAB examination, I joined as a junior doctor in National Health Service in the United Kingdom. I also started working for my FRCS degree in general surgery. In 1997, I passed my FRCS in general surgery from Royal College of Physicians and Surgeons of Glasgow. After passing my diploma in orthopedics, I got married to Rajalakshmi, who was also a doctor. She was specialized in ophthalmology at that time. After me joined National Health Service in 1995, my wife also joined me, and she also took the qualifying exam and joined National Health Service as well. Subsequently, my daughters Parvati and Lakshmi also joined us in UK, where they started their initial schooling. Myself, in 1998, I continued as a senior house surgeon in National Health Service in the Department of Orthopedics. There, it is mandatory to undergo fresh training before taking up specialization. So I continued working at the same post till 2001, and after that I joined as a specialist registrar to specialize in the field of trauma and orthopedics. My training was in northwest of England, in Liverpool. Liverpool was very world famous in training doctors in orthopedics and developing orthopedics at the same time. So I had 6 years of training in orthopedics from Liverpool, and in 2006 I passed my next FRCS examination, which is called exiting exams, from Royal College of Physicians and Surgeons of Glasgow, and I was awarded the degree of FRCS Trauma and Orthopedics in 2007. Towards the end of my training in Liverpool, I did my fellowships in hand surgery and also another fellowship in shoulder and upper limb surgery from Manchester. In 2008, I joined as a consultant shoulder and upper limb surgeon at Durham and Darlington University NHS Hospital Trust, where I worked and concentrated in the field of shoulder and upper limb surgery. I had a good experience from the university hospital because all the complicated cases of a shoulder were referred to us at the time. I had 3 colleagues in our department of shoulder and upper limb surgery, and we were handling all these complicated problems of shoulder. I worked in the same hospital till September 2011, and then I moved back to India. I joined Sunrise Hospital in November 2011. By that time, the shoulder and upper limb surgery has taken further steps throughout India, and the Shoulder and Elbow Society of India was revamped and started in 2012 with its first annual meeting in Calcutta. I was a founder member of that society, and eventually we also started the Shoulder and Elbow Society of India Kerala chapter in Kerala last year. I should say my career of 16 years in the United Kingdom probably has changed my attitude towards the patient and towards my practice as well. What I have seen there is complete professionalism in every field, not only in the medical field. If you are going to any other service sector, you will get a complete service. So I was inspired with that, and I also changed, or my personality also changed accordingly. My wife also joined the National Health Service, and she also took specialization and FRCS in ophthalmology from Royal College of Surgeons of Edinburgh in 2000. She continued work in the United Kingdom for another few years, and by the time our daughters were growing up and we wanted to grow them up back in India, so they came back by 2005 to settle back in India. I stayed back in the United Kingdom with a frequent visit to India and my family visiting frequently to United Kingdom. When I started initially, I had quite a few shocks from the patients and their relatives. Not really shock, but it's mainly because of the lifestyle. One example is visitors in the hospital. It's not like ours. Here, in our hospitals, somebody in the hospital, then there are a lot of people visiting the relatives or the patients. There, generally the visitors are not allowed. There's a strict visiting time, and moreover, many of the relatives are not interested in visiting them in person. So instead of that, people will send cards or people will send some flowers through couriers. So they don't physically come to the hospital. But the shocking one was one of the old ladies in her late 80s was in a critical stage in the hospital in my ward, and I was looking after her. And her son and the family was away in Australia for holiday because the lady was critically ill and she was about to die. And the next of kin was in the records was her son, and the hospital, the staff contacted him over the phone, who was in Australia, and the reply was shocking. He didn't want to cut short his holidays, and he asked not to call him back in case anything happens, and he will call the hospital in due time. I couldn't quite comprehend this because this was totally different from the culture where I was coming from. This was totally in contrast with another patient I came across a few years later in 2008. We had an 80-year-old gentleman in our hospital, admitted under my care, and he was diagnosed with the cancer of his lungs. He came with a pain in his arm because the cancer has spread to his humerus bone in the arm. And his daughter came to see me to inquire about the problem. And that was the first time we broke the bad news to her, that her dad has got cancer and it has spread to the bones as well, which means it is a terminally ill stage of the disease. The gentleman needed a nail fixation of his humerus bone to prevent further problems. When I explained this situation to the daughter, she was in tears. Usually we don't come across that sort of emotions from British people, but she was totally lost. She loved her dad so much. And then I pacified her and we went on with the surgical fixation. This was in total contrast with the first patient I was explaining. So there are people who cares for the family, just like what we used to do. I was so much upset about this incident because my mother was diagnosed with cancer of the lungs on the same week, and I was far away from my mother, to whom I was very much attached to. So I was also feeling very emotionally very low at that time. And 2 days later, I came back to Kerala, and my mother died nearly 10 days after I came back here. My work is mainly keyhole surgery. Most of my patients' surgery are done through the keyhole. So the advantage of a keyhole surgery is that they don't have to stay back in hospital for long. Maximum number of days they are in the hospital is 1 day. And pain is less, there is no scar, and the success rate is also very high. It was quite easy for me to incorporate into the system back in Kerala, and it was quite easy for me to establish the shoulder and upper limb surgery unit in Kerala. Initially, when I take patient for a surgery or fix patient for surgery, they couldn't believe that they will be leaving the hospital a day later or 1 day later. Because in conventional surgery, they will have to stay back in hospital for quite a few days. Also, I will let most of my patients to go back to work in the immediate post-operative days, probably a few days, 2 or 3 days after surgery. A year ago, I had a patient from Trivandrum with her right shoulder problem. She is now 69 years old, and she met with a major accident in 1986. She had repeated fracture. She had repeated surgeries to fix the fractures, and even then it was so complicated that she couldn't lift up her right shoulder. So she was using her left arm. So she wanted to start using her right hand. As usual, 30 years later, she had a previous fracture which was fixed with a plate, and she has developed wear and tear arthritis of her right shoulder. So she was advised by many that she won't be able to use the arm further. So I have counseled her and convinced her that I can do a special shoulder replacement so that she will start using her arm. She was in double mind, and with a little bit of hesitance, she agreed for surgery. 2 months later, she started using her right hand for practically for everything. She was so happy that she could eat with her right hand for the first time in nearly 30 years. I think it's important for people like me to popularize other health related issues. And I understand that one of the biggest problems is our lifestyle and change in food patterns. Me and my colleagues have taken organic farming to cultivate the vegetables devoid of pesticides, to have a healthy life and a healthy lifestyle. I think after my initial training in Kerala, the best thing I did was to have further training of my career in a developed country like United Kingdom. That has changed my practice and my attitude. I am trying to impart the same thing to my colleagues and my friends back in Kerala. I'm sure we can succeed and change the society like that.